Hi, welcome back to Future Path. And once again, we have Kumar Sankaran. And before we bring Kumar to the conversation, I hope you had an opportunity to listen to the first part of our podcast with Kumar, where he shares his journey. And if you have not done that, I sincerely urge you to go back and catch there so that you will be able to connect to the conversation that we are going to have now. And once again, thank you so much for following Future Path and to share it with people you think will appreciate it. And also, if you're not yet subscribed to Future Path, do it right now. So, with that, Kumar, once again, thank you so much for being part of Future Path.
Thank you, Anjana, for inviting me again. So pleasure to be back.
Well, Kumar, can you? We did talk about the name story in the first part of our conversation of why Leucine Rich Bio. I think that was your first success of your scientist journey that connected with you. And uh, why this company? I mean, why this business?
Um, we, as in, strongly believe in preventive healthcare and wanted to develop technology solution in the healthcare space that could be truly preventive. Looked into a lot of technologies and then narrowed down into genomics and microbiome to see which one can play a big role in preventive healthcare. And from there, just a little further and we kind of pivoted around the microbiome, and we've been developing products and solutions in the microbiome space for preventive healthcare. So the entire notion to start the company and to build solutions was for preventive healthcare.
So, Kumar, you said preventive healthcare, you said microbiome, you said genome, but what exactly do you do here, and who is your customer?
Sure. So basically, the new discovery that were made in the late 2000s was that we have a lot of microbes that are actually living on and in our body. So much so there are probably more microbial cells than human cells in our body. It makes you question whether you're a human being or a petri dish for a microbe. So um, when we when I first heard about this domain, I thought it was pseudoscience. I said, what rubbish. I mean, how can microbes be involved in something like this? And now I've become a firm believer that so much so that Nanju, if it's 10 o'clock in the morning, if you're craving for a coffee and vada, it's most probably a microbe in your gut signaling to your brain saying that please feed that coffee to me. Um, so so that's what the microbiome is about, understanding these microbes and understanding what they're doing in the body and how they're impacting your health and wellness. As a company, what we do is we focus on the gut microbiome, which is the largest colony of microbes in our body. I mean, if you probably remove all the microbiome from your gut, it probably weighs about 2 kgs of the
I
microbiome.
thought our skin is perhaps, I mean, our exterior is the largest.
Um, no, the largest is the gut. The skin is probably the most exposed part of it, but because of all the food and everything that goes into the gut, that's where all these little fellows love living, and they make a house, and then food comes to them. They just eat and replicate. So that is that's their lifestyle. And by doing that, they influence our lifestyle. So that's the microbiome. We, as a company, look at the gut microbiome very thoroughly. What we have done is we've developed a diagnostic, not a diagnostic, but a profiling kit, which looks at the gut microbiome, and so we look at the microbiome and we see what are the kind of microbes that are there, how balanced are those microbes. Just to give you a simple example, in a typical normal healthy human being, we'd probably see anywhere between 1,500 to 2,000 different species of microbes. Um, the lesser the number of microbes, the more problematic it is for you. So somebody with a chronic disease will probably have only 800 species of those microbes. So what we have done is we've built a testing kit which can detect the species. We can detect what is the relative abundance of each of these species, and from that map out your how it's actually affecting your health and wellness and what you need to do to correct it. Since the way of measuring the microbes is through the microbial DNA, it's by doing the microbial genetics, genomics, that we're able to measure, the relative abundance of these microbes. Hence, it falls under the genomics field.
And
So
you do it through what? How do you go about doing it?
So what we do is we send a kit to a person's house. The fecal sample or the stool sample needs to be collected. Once it's collected, so it's the stool sample will have a representative of all the microbes that are actually there in the gut. Um, so once the sample is collected, we ship it back to our lab. We isolate the microbial DNA from the samples, and we use next generation sequencing, which is the current high throughput sequencing platform that is available, to map out what are the microbes that are present and what is the percentage abundance of each of these microbes.
How do you get this consumer? Is it directly you reach out to them, or is it through the hospital? Hospital advises them that they need this, and then they refer you, and then you come into the scene. How does this cycle work?
So about 10% of our customers come directly, come online and just book the test. I mean, these 10% probably have gone outside India. They've heard about the microbiome a lot, and then when they're back, they're looking for a company and they're getting the test done. 90% of our samples come through um, people recommending for it. So these could be nutritionists, could be wellness coaches, could be doctors. So and they'd be recommending the test, saying that this is the output you get, and these are the kind of insights you will get to correct any of the health conditions that you might be having.
All right, but when you say 10% come to you directly, uh, do you refer them back after you generate the report to one of these nutritionists, the doctors who can, decipher the report and give the advice, or do you have that as your business service component to even make recommendations based on the report?
We have that as part of our business service component. So we have our in-house nutritionists that can make recommendations. We've also tied up with a few doctors that depending on the cases, how severe the cases is. If the doctor needs to be involved, there are also doctors that the people can take their report to and get consultation for.
Kumar, this is interesting. See, 10% of your business comes from this segment, and 90% comes from the other segment. And you are, while you try to cater to the 10%, you are actually indirectly hurt the 90% of the business. So, how do you make a decision to what service you should be engaging? Of course, probably that service component gives you uh, better margin of business because that you're supporting internally. But when do you say no and yes to what? Because it all has business impact, right? So, how do you arrive at this product mix?
So the one thing is, I don't think the 10% of the business is actually hurting the other 90%. The market is so big, and the awareness is so little right now. So it's a huge
Not
market.
technically a conflict of interest, right? You also do. While I recommend my patient to you, uh, if somebody comes to you, the patient is just off the tube. I don't get any feedback again. Well, I because of my references, maybe you will have a referral fee, but this doesn't come back. I mean, in that sense, I was thinking, how do you arrive at what you should focus on and how? Or is it
Um,
that you see this 10% becoming 90% eventually?
Eventually, but I can't predict when that eventually will happen. And even this growth to 10% has been very recently. It's been more
And that too,
2020.
you said mostly those who travel abroad have come down, and those are the kinds. So,
Correct.
how
Yes.
is it outside of India then? Is that a growing piece outside of India?
Outside of India, it's a pure D2C business.
Oh,
Um, it's a direct to consumer business that I mean, especially if you look at Europe and US, it's a direct to consumer business
you
that
are
is happening.
operating there as a direct to consumer?
No, we're not. We are
Oh, that's
predominantly
where you said you're going into it because you said you're
yes,
becoming okay.
yeah. We are predominantly Asian, so we get samples from India, Thailand, Philippines. We'll get samples from Singapore and the Middle East also very soon.
So all the
Uh,
outside of India is direct to consumer, is it?
No, even that is through
Okay.
through doctors. Um, See, the mindset here in India is a little more doctor driven when it comes to healthcare. Just let's just take you and I for example. When was the last time you did anything for your health unless it became something severe or the doctor came with a stick and told you to do something. So somehow the mindset, we still haven't moved fully towards let's start doing a lot of preventive activities. So it's a lot doctor driven in India, and I there are merits to that as well. I mean, hence our business is more B2B2C rather than B2C.
All right. But how do you, since you brought up the Indian mindset, how do you see the home medicine, home medication that we in India is, like you have some gut problem, nobody thinks about looking up internet and searching for your company, right? I mean, people will think have a Jira Padi. I mean, that's that's the first and most common thing people tend to think also, right? And then the next level is that Ayurveda or something, because any approach to Western is that it is chemical driven and it's exterior thing. So Ayurveda is something. I mean, at least lately that thought is growing. Previously, Ayurveda didn't enjoy this kind of positioning, and now government is backing up with Ayush as well. So, how do you see? Uh, do you see a collaborative opportunity with the evolving pro Ayurveda mindset, not just in India, even internationally? Or how? What is your stand and approach to it?
Well, I mean, it's a very, very good point. I mean, so I'm reminded of this Bata salesman who went to, I think it was Kenya, of one of the African countries for the very first time, and he said, the salesman went over there and said, "No one wears shoes over here, so it's not a market for us." 6 months later, another salesman goes over there and says, "No one wears shoes over here. It's an excellent market for us." So the India's already tuned into gut health with all these home remedies. They know the importance of gut health. Ayurveda, naturopathy has even given that importance, to gut health. So everybody knows about gut health in India. So I don't have to educate about the gut health part of it. What I need to do is tell them this new modern scientific way of looking at health, and again using, I mean, the choice is left to the consumer at the end of the day, or the doctor at the end of the day, to look at only nutrition or nutrition plus supplements and medication, um, and to correct the gut. So that is the kind of uh, mindset that I'm seeing in India. So they are already tuned into gut health, and this is a new scientific technique that is help measure gut health.
Right. And is there anything benefits you see with Ayush or this Ayurvedic formally taking off? Is that some kind of a positive thing for your business, uh, or you think it is otherwise? How do you see that?
I, from a business point of view, I don't think it is affecting us either ways. I don't think it is positively impacting it or negatively impacting it for now. Because what we do is more food. What we do is more Western medicine. It'll be probiotics or specific antibiotic if the case need be. So the Ayush department coming into place, I don't know. I don't know if it's having any impact at all. But the general mindset in India is definitely helping our business.
Right. And where does it stand from a cost point? Because I think anything genetic, genome sounds like it's beyond reach of the majority. So where does that stand?
Yeah, but unfortunately, it's still very high. So when I started and I did my own sample, it probably costed me about 50,000 rupees to do it. When we launched the test, it was 36,000 rupees. This was in 2019. And over the years, with great difficulty, from 36, we've brought the retail price down to 10,000 rupees. Um, so the one thing that we have worked very hard on is globally we have the best unit economics when it comes to microbiome profiling, and that's because of the sheer talent that is present in
But
Bangalore.
when you say globally, it is also subject to the access to data, right? Because that is one area where uh, you may still have a challenge, or are there data available globally that is made available in public domain for any new entrant like you to tap into?
No, it is. I mean, it's globally certain geographies have data, certain geographies don't. I mean, most of the Asian companies we don't have any data, so we'll have to do a little bit of studies first before entering the geography. But if you go to the US, there's so much of public data available that we can go in and plug in at any point of time.
And
But
you
it's
can
not
be
only,
competitive with the
yeah.
23andMe type kinds of people. I mean, that's one of them, right?
23andMe is human genetics. They don't do
Oh,
microbiome.
oh, they don't do
So,
microbiome? Okay, okay.
yeah, we'll be competitive with Biome and
Right. Okay.
so those kind of companies um, so it's not the data. The data is more from the sensitivity and the accuracy and the specificity and all of that. But when I'm talking about cost, I'm talking about lab costs. Once we get back the fecal samples to do the sequencing and to get to generate that data, how can we extract more amount of data with lesser amount of reagents, is something that we have worked on from a really long time. And
How are
that's
you
that's
able to reduce the cost? Is it India is as a is a reference point here, or is there a process that you have developed which is making it better? What is that advantage? Is there a patent around it?
um we're trying to file a patent around it. It's not something that is easily patentable, but that's one of the areas that we're working on. But to answer your question, the thinking was, we don't have too much of money in the bank, okay, and we started questioning everything that is being done in the lab. Why is this instrument needed? Why is this reagent needed? What is the chemical interaction that is actually happening? Can this be replaced by something else? um, and iteratively we kept experimenting, we kept questioning everything that we're doing. Even now, we're like, do we really have to add this extra reagent at the end of the step to get the output? What happens if we don't add it? Nine times it probably it fails, but on the 10th time we discover something new. um, and we put together, we put that in the process, and we're able to get more juice out of all these reasons. So it is purely from the fact that, if we were like a well-funded big company, we would have gone down like any other company, created a 50 lakh infrastructure lab and bought all the fancy equipments and never looked into all of this.
No, but this is
Since
a
we
classic design theory in terms of process of elimination. So reduce and see how best. So,
Yeah.
well, do you also collaborate with any academic research institute? Because much of it demands a very continuous effort. So it must be a lot easy to tap into an academic lab where the students also get some amount of exposure, perhaps which will be useful for their future, and a lot of your time and effort and even infrastructure and investment can get offset because the institution anyway has to have it.
Yeah, that's the beauty of Bangalore, right? I mean, IISc is a stone's throw away, and there are a lot of other good private academic labs as well. So, um, uh, using their infrastructure, using their expertise, in return, students getting access to the kind of knowledge that we are generating. So, a lot of very good collaborations happen that way. That with a mixture of this being the IT hub and also IIM being present in Bangalore makes it a very, very good mixing pot for good biotech companies to come out.
Right. Just stepping back once again from the pricing side of it, it is still few times more, right? Almost 10 times more from a traditional stool sample uh, test. From a mindset point of view, somebody has to be advised to do that, right? And also, and that is by itself marks a significant barrier. So, how do you see? By what point of time do you think it becomes uh, uh, accessible to everybody and anybody?
Yeah, so that's the constant endeavor to bring the price down to a point where anybody and everybody will be able to do it. The technology is expensive, so it is taking a little bit of time for me to bring down the price to a point where everybody can do it. But as we're doing it, um, even at 10,000 rupees now itself, we're getting a lot of volume coming through. And as we reduce the price more, I think more and more of that volume will come in. Three things at play. One is our own ingenuity to make sure we kind of the process I mentioned of trying to get more out of the reagents. Secondly, like you rightly mentioned, India being from a human resources point of view, being a very cost-effective place with really good scientists here in India. And thirdly, the other thing that I'm slowly seeing, slowly but surely, post-COVID, there's been a lot of Indian reagent manufacturers that are coming up, and we'll soon be able to replace a lot of things that needed to be imported from Europe to an Indian manufacturer, and with the same amount of quality. So that's a good new development that is being happening in the ecosystem.
But when you look at market expansion, see, shipping the stools, samples, do the study here, send the report out is a complex thing, right? And you will have to look at setting up your labs locally. So at that time, will you still be able to have this cost advantage or the other resource advantage that India currently provides?
Um, yes, it's a complex thing. I've probably now got a PhD in stool logistics and fecal logistics, so it's complex, um, uh, but we've managed to pull it off. I mean, we're getting samples into India, and from different parts of Asia. It is
But
it
that is
from
current, right? But future, you see the same thing, or do you see your labs there?
I would say I think 70-80% of the samples will still come to India. Maybe one or two countries, where the market is going to be sizably very, very big, we might set up labs there. But the good thing is all the R&D work has been done in India. All we have to do is translate that in the US lab where we'll still get good economics.
Right. So So interesting. So you still see there is better economics in moving. Yeah, just another question in terms of to what point do you see that it is necessary that everybody should be able to afford? Because see, technically, everybody affording makes it one, it has to be absolutely free, or two, it has to be given through government because that's the only way we can reach everybody. So, considering that, uh, how far do you see that it is okay that not everybody can afford it, like Apple, right? Because you just can't make it free, or otherwise you'll have to go to sell it to the government. The government subsidizes it. So, which of this is the way you see as the way forward?
So I think every startup's biggest discovery is the inflection point. What is the highest cost where you get the maximum number of sales happening? How much do I have to lower it, and how much more will it go up by? I think you keep doing that math, you keep doing that prediction, and you keep doing, and from there you'll be able to arrive at where at what level you're going to say stop. I'm not going any further down from this. But saying that, we're in the healthcare space. We serve the chronic disease segment, and most of the chronic disease patients in India are in the middle class, um, especially lifestyle diseases, diabetes, obesity, cardiovascular risk diseases, and all of that. So we want to make it affordable for most of the middle class. So that's the mantra that we've been following, and we'll get that pretty soon.
In that context, do you see a point where insurance will cover these things
In India, I don't think so.
in future? No,
In I think there are few structural changes in insurance that needs to happen before insurance starts
because some of
covering.
these things are covered in the West.
Yeah, it is. It is.
So
In the
don't you
West,
see this will happen in future, or do you see?
I'm not an expert here, Nanju, but I'm hopeful it will happen in the future. But from what I hear, I think a few structural changes needs to happen within the insurance industry before you know um, these kind of standalone tests also becomes part of the insurance coverage.
So Kumar, is there any kind of an industry body that you're part of to make a case for the line of business, or even such recommendations at a policy level? I mean, how do you place yourself on an industry point of view as your entity? Where do you place it?
So I mean, it's a new industry even worldwide. Even the FDA struggles to put rules and regulations for the microbiome industry right now. If you look at the data, there's not a single microbiome based diagnostic that has been approved by FDA as yet. So globally itself, there's a little bit of challenge when it comes to regulations. So when we started the company and we started working in this domain, we were, I think, the second company out of India. The first was Department of Biotechnology, central government. The second was our company, a part of this global alliance called GA4GH, that is a Genomic Alliance for Global Health. And we were trying to through that we were trying to build regulatory frameworks to see, from a reporting point of view, from a testing point of view, what needs to be done. Within India, we are now interacting with both ICMR and CDSCO to see how we can help them come up with this entire regulation around framework around this space.
Could you just break down those acronyms for the benefit of our listeners and audience as well? ICMR and
I'm sorry, I don't know the full form of ICMR, but it is both the ICMR and CDSO are central government bodies which are in charge of approving any kind of test in
okay.
within India. So if you when you're
So
doing
you
your
need to be you have certifications from them to do this business, if you can put that.
yeah, right now we have a no objection certificate from them saying that this is not a It's a not a certificate. It's a letter saying that this is not a diagnostic and should not be treated as a diagnostic
Oh,
chemicals.
interesting. So interesting. Okay, so technically, you're in that space of time as a business where there is no compliance. So you're in the gray, so to speak.
Mhm.
Only thing is that compliance says you're not illegal. So, like most businesses, right, there is a life cycle of a business. When you start the business, there is no law or rule, right? And only thing you need to be complying to is that you're not illegal to be doing it. And
Yes.
then eventually it becomes legal to do. And these are the things you need to follow to be legal to be doing.
Yes. And I think the framework for all of to make it very legal and to get the regulations in place, it'll take a long time. I mean, like I mentioned,
But how
globally.
does this work with hospitals where they are driven by hundreds of rules, right? To say this is what you have to follow, these are the kind of vendors, suppliers, or even labs, everything. So, how does 90% of your business come from that side, which are, I mean, overloaded with rules and compliance?
Uh, uh, like I mentioned, we are not illegal as yet. We're not. I'm sorry, we're
No,
not
no,
illegal.
correct. You're not illegal. I mean, see, I run a business in blockchain space, so so there are a lot of things we say that most important thing is that this is not illegal. So,
Yes.
so I completely understand, agree, but I'm trying to understand how does hospitals and this traditional ecosystem, which have complete compliance in place, even from a point of where they engage the supplier or service. Right, even for waste disposal, there are clear guidelines as whom they should work with and how. I mean, there are still a lot of things to be improved, but still
Yeah, yeah.
there is something. So, in such scenario, how do they work with you? You are not illegal, perfect, but you are not recommended. You are not even classified as a what did you say? What
Diagnostic.
lab? Diagnostic. So it's
Yeah.
not classified as diagnostic. And so, how do they fit you into their compliant ecosystem?
So, which is again a journey. I mean, it's not straightforward for any hospital to immediately, put us
Okay. So it's more
as
the doctor, the individuals who are better informed about it. It's their call.
yes, it's their call. But once they make the call, we speak to the management and we comply with all their rules and regulations that they have, and get
But
into
how
their.
easy or difficult is that? Because
It is difficult. It's part of the business. It's something that we need to do. And we acknowledge that and we do it. There is no easy way out for this. There is a reason, whether we like it or not. There is a reason for regulations to be
yeah, it's
in.
deals with human life. So
It deals with human life. So we need to respect that. We need to respect what the doctor's saying. We need to respect what the hospital management is saying. If there is a study that they want to jointly conduct together before onboarding the test, we conduct studies together before onboarding the test. So we have to jump through these loops before we can before doctors can start recommending it. And still, it's still a long way to go. We are doing everything that is necessary to ensure that we get a CE and FDA approved diagnostic at a certain point of time. Maybe I'm hoping it'll happen in the next 18 to 24 months, but I mean, it's a long drawn process. I don't know how long it'll take. The next best thing is to get the ISOs done. So we've already got a couple of them done. We're getting I think there are two more that'll get done very soon. And the holy grail of ISO 13485, if I'm getting the number right, which is one step short of getting the FDA approval. If we can get that done in the next 12 months, nothing like it.
interesting, and wish you all the best on that. And are there any efforts you are putting as individual and as a company to create some kind of a lobby group to make your case and life easy from point of doing business and expanding business?
Um, lobby group, as in
As in some kind of a, maybe even within industry body, creating a chapter focused at this, or is there an extended body, or I mean, there is already some studies done, or work done, a group in genome. You are trying to tag along with them and try to infuse the uh, gut side of it, or the microbes, or is there anything like that you're trying to activate yourself or as a company?
we are constantly interacting with a lot of the department, especially Department of Science and Technology and the Department of Biotechnology. And we've been called for a few of the roundtables where microbiome in specific has been discussed. Um, Whenever such topics are being discussed, as an industry partner, we're usually invited. So we've been present in that, and that's where we are presenting the case. Um, the From a personal point of view, I've been meeting a lot of a lot of the decision makers and policy frameworks, a lot of them, and been telling them about what this domain can do. Um, I am not very sure what policies and all should be there, but more in the education of what the microbiome is and how much it will impact healthcare today and 10 years from now. So that, and on a personal level, is something that I inform a lot of people.
Right. And do you want to use this platform now, if you have to give a shout out to some people who could potentially be your ally in doing this? What kind of people do you want to give a shout out to? And also, if you want to give a shout out,
Sorry, Nanjala, I missed
I mean,
that
in
question.
this process, if you want to give a shout out to some people, right, coming from various backgrounds, do you want to give a shout out to them to reach out to you so that you could probably work more aggressively and strongly on this effort?
Anybody who's in the government policy, in the ICMR or CDSO, working actively on something like this, I mean, I'd love to hear your thoughts. I'd love to share my thoughts. So, please, anybody listening to the podcast, reach out to me, and we can work together on a lot of the frameworks.
Yeah, his personal social handles are there, company details are there right below this podcast. So please feel free to read that. Kumar, one more thing. Are there companies or businesses that, in your opinion, in India are approaching towards this line of business and you think they're doing good? I mean, Indian or multinational, who you see are formidable players going forward coming out of India?
Well, I would say a lot of them, lot of good, interesting startups in the ecosystem that are really good. I'm very glad to see a lot of life sciences startups now coming up, and they're building interesting technology, and the model is they're trying to license out or sell their patents to a lot of the global companies with the technology that they're building, or even expand companies into bigger markets. So very good, interesting startups that you see in the ecosystem of late.
And any shout out to them if you see there's a way you can collaborate with them?
So anybody wanting to do clinical trials with the perspective of the microbiome in mind, please reach out to us. We'll be able to conduct the trial jointly. So anybody in the nutraceutical pharmaceutical space doing any kind of trials or research, we'll be able to help them out.
Wonderful. Yeah, like I said earlier, the links are there right below this podcast. So please feel free to reach out to Kumar and perhaps any of his co-founders as well. And uh, Kumar, just are there any before I close this, I just wanted like to ask these things. Are there any uh, I'm sure all of us make mistakes, and you did say that earlier. I don't know whether it was in the first podcast or in this conversation that you made a lot of mistakes. But are there any mistakes that really stand out and which kind of change the way you do things? Uh,
Um,
yeah,
yeah, especially from an Indian business point of view, I think it is very important to take care of all the compliances. I mean, a startup, we tend to ignore a lot of these basic compliances that needs to be filed on a regular basis, and the way you get money into the company. When we started off, we would randomly put little whatever money is there in our personal account into the company's account without actually having good paperwork backing all of that. My um, yeah, I think that one of the biggest mistakes I made, and the lesson I learned a little hard was get the compliances right. Otherwise, um, uh, when an investor is willing to give you the check, this is the first thing that they're going to look at. And at that point of time, you're going to be scrambling around to fix all the issues, and the check is going to get delayed by about 3 or 4 months. So make sure from day one you can get the kind of compliances right. Um,
yeah.
um,
On this point, I just want to bring in there are a lot of times founders tend to put the money as debt, but and thinking that when the investor brings the money, I'll take it out. And investor says the money I've put in is not to pay off your debt, but to run the company forward. So
yeah.
I'm assuming that's one of the things you're referring to. So,
Yeah, that's one of the things, and when you don't have good paperwork backing all of that, good ROC filing backing all of that, then it becomes it's
difficult.
very
Yeah.
small trivial things, but it's better to address all of that and keep that ready. Um, the second mistake that we did was this is something that I personally feel was we started off purely as a computational biology company, and it took us a long time to start getting into the lab side of things. And looking at how good we're doing in the lab front now, I just wished we'd got into the lab side of things much earlier instead of outsourcing the lab work. If we had gotten into it much earlier, we would have got the price point down to much lower by now.
But it's also the cost, right? I think the cost of setting up a lab would have been much higher.
Yeah, yes, but saying that the cost was always high. I mean, even when we eventually started, we started just we started because we were going to see scale, and we thought it's better to get everything, all the lab work done, within the company, and that's when we realized, oh, there are so many areas that we could have improved on if the lab work was under us. And this is an advice a couple of investors actually gave us early on in our career. I mean, why you outsourcing this part of it? I mean, get that into your thing. I mean, you will figure a way out for the money, but just get it into it. And I think we were a little gun shy to do it. I think
But Kumar, one of the things that are growing is lab as a service as well, right? So, given that, it is far more prudent, right, to have focus on your core and work with others who specialize on that. It gives you a much better runway and speed also, right? Because otherwise, you have to put a lot of capital to physical infrastructure, which limits your scalability as well.
so. This was the thinking exactly what I had when we didn't have the lab. And then what we realized is for microbiome kind of sequencing that needs to be done, there are not too many labs in India which can do it. Probably about at that point of time, there probably would have been about 5 labs that were doing it, and most of them are startups, so you don't know when they're going to shut down. Kind of thing. So this is not something. This is not a regular biochemistry diagnostic test that can be outsourced to lab as a
What about
service.
Department of Biotechnology has set up some labs, right? That does give you access, or they don't give you access.
Nowadays, those accesses are much better. It's much easier, much better to kind of do it.
Oh, earlier it
Uh,
was not available, is it? Okay.
Earlier, it was a little bit of a problem. Like I said, everything was new, so even they were taking. Initially they were per sample. I think they were taking about 12 weeks to process everything and give it to us. Whereas if we got it in 3 or 4 weeks, it would have been great for us.
Mm,
Kind of.
mm.
On your second point, when we eventually started the lab, we didn't spend a lot for the infrastructure. We didn't spend. We had a very, very tight budget, and we managed to do everything in that tight budget. So, and it is our core business. I mean, we are not setting up a lab to do everything from A to Z. We are doing very, very one specific thing in the lab. And when you have that approach, you can eliminate a lot of the cost that's involved in the lab infrastructure.
Mm. All right. And also your work, it's a lot of data simulation, right? So is there any global agency that you're part of to get access to the data or work that somebody else is doing, so that obviously in such a scenario you will also have to share. So how, are you working with such agencies? Are there such things?
All we microbiome companies are very, very selfish. We know the importance of our data and we never want to share it. So the only data that we can globally that we have access to is all the publicly available academic data. Otherwise, the only way we get access to other kinds of data is when somebody partners with us, to jointly to do some research together. Otherwise, we don't get access to that data. But yeah, I mean, with a lot of the public data itself, it helps us do a lot of the simulation. So uh, there is no way that any microbiome company anywhere in the world is going to part with their data.
Uh, yeah, I previously said that was the last question, but uh, so what kind of a company are you? Do you see you're a tech company, you're a health tech, biotech, a microbes company? So what are you then? How do you put yourself in?
Depends on what kind of an investor are you, Manju. So we are a life sciences company. We are a deep science life sciences company. Um, Although we do a little bit of consumer facing business, our core ideology and business is to develop more and more IP around the microbiome. So we are a pure life sciences biotech company in the healthcare space.
And how much of AI application do you see and have in your business currently?
Um, so when you're saying AI, if you're saying statistics, masters AI, we do a lot of statistics, but a lot of late we're doing a lot of machine learning. So right now, entire world's data put together and entire world's knowledge put together, we probably understand only about 10% of the gut microbiome. There's so much of discovery that still needs to be made of that. With machine learning, we're able to do a lot of predictions with it. This is not part of the consumer business. This is more part of the R&D efforts that's going on. And from that we hope to generate new products in the future. So some of the EML techniques is what we are employing right at the moment.
So it's basically on proprietary algorithms. You don't use any third-party AI tools. Uh, Currently, a lot of them are being made available, right? And for small fees.
We experiment on both. We try with limited exposure of our data. We try and use third party to see what kind of outcomes are coming, and similarly build something similar or better in house and use that.
Yeah, just curious on that. How much of insecurity or fear do you see in using these third-party tools? Because once you want to use those tools, you have to expose your data to those tools, right? And obviously, these third-party engines are so rich because of the data that they are able to play with. So, do you keep out a separate data set to play with that, so you don't expose your full data to them? How do you work? Or is
Yes,
that
I
a
mean,
point of reason why you don't employ much of it?
no, the reason we'd love to use third-party data. I don't want to spend time and effort building AI within machine learning capabilities within our company if I didn't want to. But again, like I said, I think it was in the earlier podcast that I was saying that computational biology is a very new, different domain. It's a different beast altogether. The kind of data that you get is very, very different. So,
No,
um,
but
uh,
this is where a third-party AI tool becomes much more valuable because they may be employed by hundreds of startups globally. So every time somebody uses them and puts in their data, their algorithms become far more mature and engine becomes far more stronger, right? So when you employ it, you're not just getting your data, but you're getting the maturity of that AI engine because of the hundred other startups or ventures globally using that engine. But the
uh,
risk is that you will also make it more rich that others can also use it.
I mean, that's always there, but I haven't found good outputs coming out of these data. I think
Okay, okay.
lot of the
So do
cleaning
you
up.
think it's because people think are afraid of sharing, like you said, that we are very selfish, we don't share our data? Is it the same thing playing on people are not really coming on to using that?
Yes, I think so. I think one any kind of genomics data is very, very size heavy. I think it's the genomics data is the second largest data footprint on the planet after astronomy. So both from a data storage and data processing, it is very, very expensive to do it on the cloud. So that is one technical reason why a lot of the cloud usage is not yet common. Secondly, everybody thinks that they're sitting on the next gold mine to discover the next therapeutic for pancreatic cancer. So nobody's nobody's going willing to give out that data, um, as freely as a lot of as it should be actually.
Right.
If we could train a few models with a lot of the global data, it'll serve everybody good. But I don't think anybody wants to be the first mover in that.
Okay. One and seriously, one last question. So,
Oh,
you're also the quasi CTO or acting CTO. So, how do you make sure, because much of your data is sitting on the system and I don't know how much of cloud, but how do you approach cybersecurity here? Because this is a serious data, critical and also necessary because there are a lot of compliance about people's data as well here. So how do you approach cybersecurity here? And are there any specific products coming out in the cybersecurity space for your kind of businesses?
Um, I think there are a lot of products there that are there in our space, especially a lot of the products that have been using in finance is now being translated into for genomics
Uh,
data as well. And the good thing is the genomics industry has led the way. Like if this is the way I usually like to scare people. If you give a drop of blood to any of these genomics, like a 23andMe kind of company, they can very easily redraw your face by looking at the DNA. They can probably measure the distance between your eyebrows. And then once you get that image, you just have to do a reverse Google image search to get the Facebook account. So the genomics company have led the way in kind of data security, and we've kind of borrowed from that. And we are because initially we were doing a lot of the services with the Western companies and
and
academic labs.
perhaps that becomes part of your compliance ecosystem as well.
Yes, yes.
But are they
We're
in place in India, or you follow what is followed in the West?
we follow what is there in the West. We think it is important, and partly because when we did since our initial work was a lot of consultancy work with industry and academia of the West, we made sure that we were HIPAA compliant and all this compliance is in
That's
place
more
before.
US. Who is stronger in this case, US or Europe? I heard Euro has far more secure compliance laws in place.
Yes, I mean, so there's a difference between so we don't get any personal information, so that is de-identified and that is stored away. There, I mean, from that Europe is very very good. So is US. I think even their standards are pretty good. So that is one layer of compliance, which I think a lot of companies in India follow that kind of compliance. The second part is that is the data itself, which is important to us. It is gibberish outside our system, but it is important to us, and for that, there are a lot of vendors in India who help us make sure that that data is safeguarded.
Right. All right, Kumar. And just from a point of future, what's the future for your company? Do we see sometime it will be public, or do you see this perhaps being acquired by a large company? Which way is your and your co-founders thinking is going on this?
Uh, I don't know. It depends on when you wake us up and ask whether what's going to be our exit. um, all we're thinking right now is we want to be the largest player in Asia in this domain. We just want to put our heads down and make sure we achieve that, and the exit will take care of itself. I mean, going public would be nice, but I'm no hard and fast rule about for any of the directions. So for the exit. We just want to put our heads down and make this a good global company with us being the number one in Asia.
Well, I hope to catch up with you on that and talking about how you got to that. And hopefully, right. Kumar, thank you so much. And to the audience and listeners, you have the links. Please do follow the kind of work they are doing. And you can always reach him. He's very approachable as well. And share it with people who you think will appreciate this. And if you're not yet following Future Fast, because we do bring people like Kumar to talk about what they're doing and how they're impacting the future. So please follow it, subscribe to it, and also do join us soon because we will get Kumar back to talk about his perspective on the future. And until then, enjoy the ride. Kumar, once again, thank you so much for doing what you just doing and also being with us.
Oh, thank you. Thank you for inviting me. It was a pleasure chatting with you.